Congratulations on completing your shoulder replacement surgery. This video will review your post-operative instructions and help guide you through the early stages of recovery. Following these steps closely is very important to ensure a safe recovery and the best possible outcome.
In the first several days after surgery, it is normal to experience pain, swelling, bruising, and difficulty sleeping. Early in the post-operative period, patients find it more comfortable to sleep propped up in a recliner. A nerve block was used during your surgery to help control pain immediately after the procedure. This typically wears off within 8 to 12 hours, so it's important to begin taking your pain medication as soon as you start to feel discomfort. This helps prevent your pain from becoming severe. Please take your medications exactly as prescribed. It's important to understand that narcotic medications alone will not fully control your pain. For best results, you should also use an ice machine, TENS therapy, Tylenol, and anti-inflammatory medications if approved by your doctor. Common side effects of pain medications include nausea, drowsiness, and constipation. Drinking fluids and using a stool softener can help manage these symptoms.
You should be wearing your sling at all times, except when showering, performing exercises, or attending therapy. Do not lift, push, pull, or put weight on your surgical arm. You should not drive until your surgeon gives you permission.
You may remove your outer dressing 48 to 72 hours after surgery and begin showering. Do not remove the white or clear mesh dressing. Do not scrub the incision or submerge your incision in water, including pools, baths, or hot tubs, until cleared by your surgeon. Do not apply creams, lotions, or ointments, and do not clean the incision with alcohol or peroxide.
You will take a blood thinner. After surgery to prevent DVT, your surgeon's office will contact you to confirm the exact medication you should be taking during your post-operative call.
Home exercises are very important for reducing pain and swelling. You should begin your home exercises within 2 to 3 days after surgery once your pain begins to improve. These should be performed 2 to 3 times per day. Your first exercise will be pendulums, where you gently allow your arm to hang and move it in small motions. Your second exercise will be to work on range of motion of the elbow, wrist, and hand. You are not permitted to do any active range of motion exercises with your shoulder. You are also responsible for scheduling your first physical therapy appointment, which should begin after your post-operative visit. If you have not scheduled physical therapy, please plan to do this now. For best results, we strongly recommend attending Orthopaedic Medical Group Physical Therapy, where your progress is closely monitored and communicated with your surgeon.
You do not need antibiotics immediately after your shoulder replacement surgery. However, several months after surgery, you will need to take antibiotics before proceeding with other procedures to prevent infection. This includes dental work, skin procedures, and certain medical procedures like colonoscopies. You should avoid routine dental work for 3 months after surgery. Antibiotics are not required for routine procedures like blood work, injections, or eye exams. Your surgeon and team will discuss this further with you at your post-operative visit.
Please contact our office if you experience any of the following: fever greater than 101 degrees, uncontrolled pain, increased redness, swelling, or drainage from your incision, new numbness, or significant swelling. Contact your primary care physician if you have questions about your general health or medications prescribed by them. If you are experiencing a medical emergency, such as shortness of breath or chest pain, please call 911 or go to the nearest emergency room.
Again, thank you for choosing Orthopaedic Medical Group for your care. We strongly encourage you to continue using all of the recovery tools and educational resources provided to you, including your total joint handbook, educational videos, and post-operative instructions. While our team is always happy to help, these materials are designed to empower you to confidently manage your recovery process and answer many of the most common questions patients experience after surgery. Using these resources appropriately also allows our staff to remain available for patients with urgent medical concerns that require immediate attention. Thank you again for trusting Orthopaedic Medical Group with your surgical care.